We spend trillions and trillions of dollars to build a defense system to protect our nations from a war that may or may not happen. We build huge arsenals of tanks, missiles, and fighter aircrafts as preventive measures. But what preventive measures are we taking to preserve our health and a healthy heart? Nothing. Absolutely nothing. My friend here deliberately waited for his heart to be attacked. Now his heart is severely damaged. So what's the point? He will have to live with a failed heart for the rest of his life. Doctors have said that even after surgery, the cells damaged in the heart attack can never be recovered. Omkar could have defended himself from an impending heart attack. We are all aware about the term heart attack, but we always think, it cannot happen to me.
So, Mr. Omkar, you are lucky you have been saved from a fatal heart attack. I have gone through your reports. All the reports show that you had a massive heart attack. The left side, the main artery is totally blocked. But since you got delayed in coming to us, most of your heart muscles are damaged. The only option now you have is to go for an open heart surgery. You see, please let me explain. It's like a sleeping volcano that can erupt at any moment of time. This time, fortunately, we saved you. But if it happens again, next time you will die.
Sir.
Hello, sir. The patient's condition is now stable, so you can leave. We will take care of him.
All right, thank you.
Why me? Why me, Digesh? I don't smoke. I'm not overweight. I don't lie. I have never harmed anybody. Then why did this happen to me, Digesh? Tell me, why did this happen to me?
Don't worry, Omkar, don't worry. Everything will be fine. Don't worry.
My heart is so precious. Why did I not take care of it? Why did I not take care of it?
I found IPC Heartcare Center. And after reading what they do, I wanted to know more about them. So I visited one of their centers for consultations to prevent a heart attack. At IPC, I did my stress test, eco test and blood test and had consultations with Team IPC. After the tests, I got my reports and I met Dr. Pratiksha, the founder and chairperson of the IPC Heartcare Center.
Mr. Digesh, there is good news. All your reports are normal, now. But that does not mean that it will be normal in future also.
What do you mean, doctor?
Like what we see is that most of the times when we do a health checkup, the reports come normal, but then people take it as a license to continue their irregular lifestyle.
Okay.
So like at IPC we have a very different approach. Like when we discuss the reports, we also like look into the lifestyle and we start helping people to correct the lifestyle. Like what I can see over here, that little bit the cholesterol is on the higher side, sugars are borderline. But one thing is for sure, you're not exercising daily.
But how can you say so confidently? Just today morning, when your assistant doctors were taking my history, I told them I do exercise. And I do walk when I go for shopping or take my family to the mall.
Yes, but that is not counted as a cardiovascular exercise. Dinesh, what I mean is that you have to put your jogging shoes on and go for a brisk walk 3 times a week at least. Your stress test report clearly indicates that that your heart is not conditioned to exercise. Your today echo report shows that your heart function is normal. Even all the valves, are functioning normally. What I've understood, like when the doctors were taking history, they told me that you are actually very shocked because one of your friends has recently undergone a heart attack and he has gone a bypass surgery. And I think you are here to prevent one. But Digesh, unfortunately, this today echo report becomes abnormal only after a heart attack. Okay, and even the stress test, which have got normal now, this becomes abnormal only after the blockages exceed 70%. So now you understand what I meant to say, that the report should not become abnormal in future means you are here to prevent one. And what we recommend here is preventive cardiology program at IPC. Why wait for that heart attack to happen, when you can prevent one?
This is exactly what I was looking out for. And I joined the preventive cardiology program. They did my lifestyle assessment, which was a detailed investigation into my activities of my entire day, from the time I woke up till I slept. All my habits, which included eating patterns, sleeping patterns, my approach towards my work and profession, my attitude towards life, my family life, and how I handled crisis situations. It was a detailed analysis right from my childhood till now, which gave me a lot of insights into how my each and every action is either contributing towards making of a disease or keeping me away from a disease. I realized that though my reports were normal, but my lifestyle was definitely contributing towards making of a disease. And I realized Dr. Pratiksha's words. That's why she said that the reports will not be normal in the future. During my visits to IPC, I used to meet a lot of happy, cheerful patients who were friendly with me, and I used to enjoy talking with them and sharing their experiences. One of them was a 76-year-old gentleman, Mr. Vasant Thatte, who himself started interacting with me during one of my visits. I found his case strikingly different, which he shared with me.
I commenced my career as a police officer way back in 1960. I worked in the police force for 3 years in Gujarat Police and then switched over my career to industrial security in year 1962. Actually, it so happened that I have been in habit of going every day for walking for about an hour, and in those days prior to this problem, I used to walk almost about 3 to 3.5 kilometers in 1 hour. In 2007, in the month of April first time, I got the problem of getting a little burning on my center of the chest. While going walking in the evening, I walked hardly 500 meters and I started getting that kind of a feeling. So I was just taking it lightly as if I thought that it must be due to acidity or something like that, which normally everybody thinks. So I thought also that it may be an acidity problem. This went on for almost about a week.
A week later, Mr. Thatte experienced some pain in the shoulder, and he immediately went to his family doctor, who recommended him to a cardiologist. The cardiologist took Thatte's ECG and told him that he was suffering from exertion angina and prescribed some medicines. Mr. Thatte took those medicines for about 2 months, and after 2 months, when he felt a little better, he stopped taking those medicines. A week later, on one of his evening walks, Mr. Thatte again experienced pain in the shoulder.
So again I went to the same cardiologist. He said, who told you to stop the medicines? You have to take this for the whole life now. And I was completely taken aback. The whole life I have to take the medicines. Then he sent me for scan. He asked me, you should have the scan because I am doubtful. Well, let us find out what the blocks are. My cardiologist told me that Mr. Thatte, you have to go for angiography now. So myself, my son and my wife, we went to that hospital. Angiography was done. And after the angiography was completed, the doctor told me another shocking news that Mr. Thatte, you have got 290% blocks on the left artery, 370% blocks on the right artery, and 270% blocks in the center. And so you have to go for triple bypass. The moment he told me triple bypass, first of all, it was a shock to me. Secondly, I have never had any operation on my body, so I was not accepting a body to be cut like that. So I said, doctor, can you tell me what are you going to do? Triple bypass, and what will you do? He said, we will take one nerve out of your left thigh, another nerve from your right thigh, maybe third nerve we will take from your hand, and then we will put them in. Bypassing the block, we will do the heart operation. I said, doctor, can you tell me one thing? What is the guarantee? After this operation, what is the guarantee? How long you think I can live if I am going for this operation? He says, no guarantee, not a day's guarantee. I said, then why should I go for the operation? If there is no guarantee, why should I go for the operation? He said, no, but Mr. Thatte, you are taking a big risk and this and that. I said, doctor, even otherwise you are not giving a guarantee for one day also, then why should I not take the risk at all? Because I knew that in my own locality area, one of my friends who had double bypass surgery, he came after operations from hospital to his house and next day he died. So what is the guarantee that bypass operation will give me even one day life?
After learning about his heart ailment, his relatives kept insisting that he go for a heart surgery. But Mr. Thatte was not convinced of their advice. His wife and children also persuaded him to not worry about the expenses incurred for a surgery and to go for it. But saving money was not the criteria for him. In India, the average life expectancy of a person is around 65 years, and in his bonus period, Mr. Thatte did not want to subject his body to scars and traumatic surgery. During that period, he was also in a dilemma about the decision he had taken, because the doctors had told him that from now on he will never be able to lead a normal life and anything can happen to him at any point of time. It was troublesome for him as he had no backing from anyone for his decision. Mr. Thatte did extensive study on heart ailment. He read books, journals and articles on this subject. When Mr. Thatte found out about IPC, he immediately fixed an appointment and visited their clinic. After consultations with Dr. Pratiksha, on the following day, he started his treatment at IPC and underwent 35 sessions of the EECP. The non-surgical treatments at IPC includes advanced allopathic medical management based on international guidelines along with US FDA approved, scientifically proven EECP treatment, which opens up the collaterals, that is, the small arteries of the heart. In a bypass surgery, the blockages are not removed, but the blood supply to the heart is increased to grafts taken from the arms or legs of the patient. The same purpose of increasing blood flow to the heart is attained through the treatments at IPC. There is a general belief that open heart surgery is the only and the fastest way to resume one's normal life. But at IPC, the same is achieved through non-surgical cardiac treatment. Mr. Thatte was extremely delighted when he got the approval from Dr. Pratiksha to visit his son in Canada after the treatment. He is now leading a normal life. But everything is not as rosy as it seems. I came across Mr. Jose, whom the doctors declared as a hopeless case. The family was ready for a surgery, but when the doctor explained that his life was at a risk even during the surgery because of low pumping of his heart, the family backed out. The doctors told his family that Jose would be on bed rest for the rest of his life. But coming to IPC changed Jose's life. Today at his age, he leads a near to normal life thanks to IPC. IPC Heartcare Center, as we all see it today, is India's largest chain of preventive and non-invasive cardiology clinics. IPC has created awareness on prevention of heart diseases amongst millions of people in India and abroad through their publications in print and electronic media. IPC is not only India's but world's best center for non-surgical cardiac treatment, as they have consistently maintained a success rate of over 95% as against the average of 80% all over the world. Coming across such phenomenal statistics, I wondered who was the force behind the success of IPC. I picked up a collection of books and DVDs to educate myself regarding this. I came to know that IPC was founded by Dr. Pratiksha, a lady with great foresight and a vision for service to mankind. She is India's first woman preventive cardiologist and the only doctor to be awarded at a national level for her original contribution in her chosen field. I was spellbound reading the achievements of Dr. Pratiksha. On one hand, I was recovering from the shock of my friend's sudden heart attack and bypass surgery. And on the other hand, I was seeing more and more of successful cases at IPC being cured without bypass surgery. A question which was constantly nagging my mind was that why Dr. Pratiksha, being a qualified allopath from the prestigious KEM hospital, chose to be different in her practice from the rest of her medical fraternity.
Routinely, everybody focuses on either surgery or gynecology or medicine. I chose upon the field of prevention. Why? It's a very personal thing. As a topper, gold medalist, I always wanted to reach out to all the people. I felt everybody should come to me. And then I felt so silly that if I keep on praying that people should come to me for surgeries, more and more people should fall sick, how would it be? So there I felt that if I pray God every day that I should save people from falling sick, what a noble thought. And that really motivated me to do my post-graduation in preventive medicine. Again, when I was doing preventive medicine, my mind always wanted to do something different, build a new pathway. And there I found that already a lot of work was done in maternal and child health care and infectious diseases. So again, I felt that lifestyle diseases prevention was something which was not worked upon. Studying about World Health Organization and the statistics related to the diseases in the country, it struck me that by 2015 in India, maximum cases of cardiac problems would be there.
Dr. Pratiksha, being a visionary, had a foresight about the impending cardiovascular epidemic in India 11 years earlier when she was doing her post-graduation at the age of 24. Since there was no formal course in India, she had to create a new pathway by going all over the world for her research and training. It took her 5 years of intensive hard work and research to develop IPC, and she launched her preventive cardiology practice in 1999. Though she began as a single woman and strived over a decade of innumerable odds to thrive IPC towards success, she, being a true leader, always acknowledges her teammates and her patients.
I thank the team IPC, a team of more than 100 doctors and paramedics who are working day in and out to give excellent results to our patients along with me. Like for a mother, every child is important. Similarly, at IPC, each and every patient is important to us. So though now we are spread all over the country and we have got many centers and many patients coming in, I have trained each and every staff in such a manner as if to look after you, as if I am treating you. Though I am not present in each and every center, but my virtual presence is always there. We are always available online. There are standard operating systems and protocols reporting in such a nice, integrated and scientific manner that we are kept in touch of each and every patient. Pioneering ECP therapy in India and being in the expert committee, we have devised protocols for case selection, which cases should be taken, not taken. So we only treat cases which are going to be benefited at IPC. We are not against surgeries. In fact, the patients who require surgeries, we are the first ones to advise them that they should undergo it. We take up cases only which will be benefited by non-invasive treatments. So far, the journey has been very exciting, though there were a lot of challenges, but I am happy that me along with the team members and all our patients, good wishes and they spreading the goodwill in the society, we have come a long way with all the laurels which we have had. Looking forward, as I told you, that the journey which I began alone, like I always thought of like this candle, that one candle can ignite millions of candles. So dear friends, though I began alone, but now I am not alone. So many ignited hearts, so many well-wishers, so many people in the community are spreading the word of IPC. So we are not far from the day where prevention and non-invasive treatments will become order of the day. Yes, that revolution will come in. In future, people will go for lifestyle changes, prevention, non-invasive cardiac treatments, and I think surgery would be kept as a last choice with the advancement in medicine. If that would be fulfilled, I think I have lived my life and my vision fulfilled. Thank you.
The IPC Heartcare Center also has a cardiac rehab program to help patients resume normal life even after bypass surgery or angioplasty. I introduced my friend Onkar to IPC and he enrolled in a post-bypass rehab program to prevent the formation of new blockages. Bypass does not remove the blockages, but the new grafts increase blood supply to the heart, which could be again blocked due to a wrong lifestyle. Onkar was given a detailed counseling on correcting his lifestyle so that he does not have to undergo a second bypass surgery. The entire team of IPC was involved in modifying my lifestyle. We generally resist change as we believe in old habits die hard. But we need to change for the better. And the motivation, guidance and the practical support provided by the IPC team is so very unique that I effortlessly transform myself into a very active and energetic health enthusiast in just a span of 3 months. Thanks to IPC.
We have taken care of our hearts.
Have you?